The day medicine lost its way. How technology broke the doctor-patient relationship and how AI might help fix it. Many doctors now spend 2 hours documenting care for every hour they spend with patients. This imbalance reflects a growing crisis in healthcare. Take Dr. Sarah Miller, for example. One evening, 5 hours after her last patient, she was still documenting the day's visits. She had spent 8 minutes discussing diabetes management with a patient and 40 minutes writing it up. Something was clearly broken. This story is not unique. For a typical 24-minute visit, doctors spend 16 minutes on the computer and just 8 minutes with the patient. The result is that physicians, often highly trained experts, are spending most of their time on clerical tasks. This burden is costing the U.S. healthcare system $90 billion each year. But the true cost goes far beyond the financials. It affects both doctor well-being and patient care. The weight of documentation is more than a nuisance. In 2023, studies showed that 92% of physicians work outside scheduled hours to finish documentation. Medical errors rise by 38% when doctors spend over 4 hours daily on electronic health record (EHR) tasks. And healthcare organizations lose roughly $165,000 per physician annually due to inefficiencies in documentation. Only 27% of physician time is spent in direct patient care. Most of it goes to paperwork and admin. Moreover, 71% of doctors say documentation interferes with their ability to think clearly and make complex clinical decisions. On top of that, documentation alone can add $31,000 annually to the cost of care per hospital bed. Burnout in healthcare doesn't come from patients. It stems from everything that blocks doctors from doing what they trained for, caring for people. The EHR, originally meant to enhance care, has become a primary source of frustration and burnout. Physicians are calling for change, not just shifting the burden elsewhere, but removing it altogether. Some institutions have already started down this new path. At UC San Diego Health, AI-powered documentation tools reduce physician documentation time by half. That time was returned to the physicians, to spend with patients or simply to get home to their families. Unlike traditional EHR systems that require doctors to adapt their workflow, AI scribes are designed to fit into the way physicians naturally practice. These tools listen and learn silently in the background. There are no prompts or commands. Instead, they observe, understand, and support in real time. During a conversation, everything worth documenting is captured, accurately and instantly. These systems can create visit summaries, referral letters, follow-up plans, lab orders, and even generate billing codes without the physician lifting a finger. This isn't theory, it's already in motion. At Mayo Clinic, security and compliance were addressed from the outset, and the technology was smoothly integrated into existing systems without disrupting workflows. The results were clear: better retention of physicians, improved patient satisfaction, and significant cost savings. Consider the experience at Providence St. Joseph Health. At their Newport Beach facility, AI-powered ambient clinical intelligence transformed the way doctors work. When Dr. Sarah Chen enters the room, the system activates automatically using secure sensors. No voice commands are needed. As she talks to the patient about symptoms, headaches in this case, the system captures the relevant information, organizes it into a structured SOAP note, and distinguishes between subjective and objective data. During the physical exam, Dr. Chen speaks naturally. Observations like pupils equal and reactive to light, no neck stiffness, are automatically recorded as objective findings. When she prescribes medication, sumatriptan, 50 mg at onset, repeatable in 2 hours, the AI updates the prescription, generates easy-to-understand patient instructions, codes the visit for billing, and drafts a follow-up plan. By the end of the visit, the documentation is complete. Dr. Chen quickly reviews and confirms the note in minutes, instead of spending 15 to 20 minutes writing it from scratch. Doctors are staying present with their patients, not distracted by screens. The benefits are measurable. Across several health systems, documentation time has dropped by 50%. Productivity has improved. Physician burnout is declining. In a typical 25-physician primary care practice, the results of AI documentation implementation are substantial. Each physician saves around 405 hours annually, cutting documentation time in half, from 15.6 to 7.8 hours per week. This efficiency enables them to see an additional 416 patients per year, increasing their weekly patient count from 80 to 88. With revenue per visit steady at $150, this translates to $62,400 in extra revenue per physician. Moreover, the physician turnover rate drops from 17% to 8%, contributing to a $297,500 reduction in turnover-related costs. These turnover savings are based on average replacement costs of $250,000 in the US and $190,000 in the UK per physician, and a 9% reduction in turnover. Altogether, the total first-year return on investment for the group reaches $1,957,500. And there are even more gains in quality and compliance. At Cleveland Clinic, documentation quality scores increased by 32%, and documentation-related denials dropped by 27%. Providence St. Joseph Health saw a 24% boost in clinical documentation integrity and fewer documentation queries. At Oxford University Hospitals, coding accuracy improved by 22%. Physicians are also reporting meaningful qualitative benefits. 70% say they have more eye contact with patients, strengthening the physician-patient relationship. After-hours documentation dropped by 51%. Face-to-face time increased by an average of 3.5 minutes per visit. The cumulative impact isn't just time saved or money earned, it's a change in how doctors experience their work. Many say they're reconnecting with the reasons they went into medicine in the first place. Healthcare leaders are increasingly recognizing this potential, but they often ask, where do we begin? The answer lies in process, not just technology. Organizations that succeed start by understanding their current workflows and pain points. As one executive put it, the technology is the easy part. The bigger opportunity is in redesigning how care teams work. At GreenM, we've seen that the best results come from a structured approach. Start with assessment. Map your current documentation burden. Run a pilot. Involve engaged clinicians who want to test the tool. Measure what matters. Track the time saved, care quality, satisfaction. Expand strategically. Scale based on real data and feedback. AI documentation isn't just a tech project, it's a cultural shift, a move to bring back the human side of care. If you're curious how this could work in your setting, we'd be happy to share what we've learned and explore whether now is the right time to begin.